Well, hey guys, welcome back to the Q&A. So, the temperatures are dropping, probably getting very cold depending on where you live in the world. And this week I wanted to talk about dry skin on the Friday Q&A. I think it's appropriate for the time of the year, and I hope to share with you guys some of my favorite moisturizers in a video later next week, so stay tuned for that. But today I'm going to be talking about dry skin on the body and dry skin during the winter time, how to deal with it, and that sort of thing. If you're new here, welcome. My name is Andrea. I'm a dermatologist. I post fun day in the life vlogs as well as some fun recipe and lifestyle videos. But my content is largely skincare focused, and I do a weekly Q&A on a skincare topic of interest, as well as review a lot of skincare products, their ingredients, and that sort of thing. So if this type of content is of interest to you, I encourage you to stick around and check it out. So, I've talked about this before on the channel, but if you think about your skin as sort of like a bed, and you have a mattress that corresponds to the dermis, or the deeper layer of the skin, and then you have all of your bedding on top, your quilts, your linens, and that sort of thing. And the quilts and linens on the top are similar to our epidermis, okay? They're sort of a different layer of our bedding, so to speak. And dry skin occurs when the very, very top layer of the skin, the stratum corneum, the very top layer of the epidermis, becomes too water deficient, okay, and has lost too much water, and that results in the stratum corneum kind of having a dull appearance, being flaky, and dry, and predisposing to cracked skin, fissures, and bouts of itchy skin. The function of our skin is to form a barrier and to keep, fluids in. But as it becomes dry, it becomes a little bit compromised, and so it starts to lose water more readily. That's called transepidermal water loss, okay? And, the medical term for dry skin, we have all these fancy names for it, like xerosis, ichthyosis, asteatosis. But, I think at the end of the day, we all have at least dealt with dry skin at some point in our life. It's quite a common and prevalent skin concern. It affects men and women of all ages. It doesn't have a gender predilection, so this video is not just for women. Skincare is for men and women, so hopefully that message is clear to you guys out there watching. But there is a little bit of racial variability in that certain ethnicities may have a predisposition to drier skin. And this predisposition reflects some subtle variability in the lipid content of the top layer of the skin. Not only the lipid content, but also some of the proteins that make up our top skin barrier. One such protein is something called filaggrin. Dry skin can start at any age, but people who may have a little bit of an underlying genetic susceptibility to dry skin, such as people with different forms of filaggrin, they all develop dry skin very, very early in childhood. So, depending on your family history, it may be something that you've been plagued with all of your life, or merely episodically as a result of your environment. If you have atopic dermatitis or eczema, you're also probably intimately familiar with dry skin. It's a cornerstone of the eczema features, unfortunately. And you probably are well aware of the fact that keeping it on top of your dry skin is essential to prevent flares of your eczema and bouts of itchy, inflamed, rashy skin on the body that can be quite uncomfortable. Another ingredient, if you will, in the skin barrier is something called ceramides that can become a little bit deficient just with time and chronology of age. And so much so that nearly everyone over the age of 60 is going to be dealing with dry skin, okay? So you can see how this is quite a prevalent issue. There are also certain diseases and conditions that unfortunately are associated with very, very stubborn dry skin. I think postmenopausal women out there will relate to this, but after menopause, because of some of the hormone changes in the body that normally kind of drive some of the oil production that keep our skin hydrated, that changes a little bit. And so after menopause, women are more plagued with dry skin, not only on the body but the face as well. Today's video I'm exclusively talking about dry skin on the body, but if you'd like, in later videos perhaps I could do a dry skin on the face and facial moisturizer talk. So also certain medical conditions, namely hypothyroidism and renal diseases, can really be associated with dry skin. Hypothyroidism in particular, that may be one of the most notable signs to the individual, and always a good reason to check in with your healthcare provider and potentially get a blood test just to make sure the thyroid is okay. Also, treatment with certain prescription drugs can affect the skin barrier, as you know, sometimes as part of how they work, and result in dry skin. I think the one that probably most commenters are most keenly familiar with are retinoids, whether they be topical retinoids like Retin A, tretinoin, or differin, adapalene, or tazarotene, Tazorac, and Retin A in particular of the topical retinoids tend to have the most dryness. Differin tends to be a little bit more well tolerated, but you're aware that can cause quite a bit of dryness on the face as it's turning over the skin barrier a little bit more expeditiously. Water loss accelerates and the skin becomes a little bit drier. Moisturizers become paramount. Also, retinoids that are systemic, namely accutane. Anyone out there who has taken accutane, or also known as isotretinion, is keenly aware of the dry, peely skin that results from taking this medication. I would like to do an accutane video in the future. I haven't done that yet. I get this question all the time: what are my thoughts on accutane? Suffice it to say, it is a great drug for many types of acne in the right patient. If that happens to be you and you're taking this drug, you know very well that it's associated with dry skin. So hopefully this video today will be helpful to you as far as moisturizers on the body. Also, a lot of blood pressure medications can be associated with dry skin. Things like in the class called calcium channel blockers, for example, diltiazem, hydrochlorothiazide. And when I say these names, these are the generic names of them. So if you're not sure, a good way to know is to take a look at your prescription bottle. It'll have some jazzy brand name on it. But in parentheses, it always has the actual drug name, so that's a good way to actually know what you're taking. And so, like I said, hydrochlorothiazide is one that can be associated with dry skin. I can list some down below in the description box as well for you guys in case you're wondering. And unfortunately, people who are having to go through chemotherapy, which can be very traumatic in and of itself, are keenly aware of the fact that a side effect of a lot of chemotherapy is dry skin, as well as a spectrum of many other skin, hair, nail manifestations, but dry skin is probably the hallmark one of many chemotherapies. So if you're going through that, my heart goes out to you, and I hope this video and these tips are helpful to you. But I think in our everyday lives, where we notice it the most tend to be in situations where the environment changes a little bit. Our ambient humidity drops. This is most notable in the winter time when the air becomes drier. We're cranking up the heaters in our homes and businesses, places of work. Really sucks the moisture out of the atmosphere, and as a result, your skin loses more water just in terms of a homeostatic mechanism, and you become drier. Your skin becomes drier. Individuals who reside in desert climates, I know I have some viewers in Arizona, hello, you are plagued with this more year-round than seasonally because you live in a drier climate. I used to live in Colorado, and it was quite dry there as well, so I can relate to that, and that your dry skin needs are a little bit more ongoing. But likewise, excessive air conditioning in the summer months can also dry out our skin, just by virtue of the coolants kind of altering the humidity in the air. So, even though here in Texas in the summer it's so hot and humid, and the idea of dry skin is like, what? Probably irrelevant. It can happen if you're in the air conditioning all day, or that high blowing air conditioning can definitely dry out the skin. So it's not just the heaters. But I think probably the practice that really can be problematic and causative for most people's dry skin, regardless of the background of the individual, has to do with their bathing practices. Bathing in and of itself disturbs the skin barrier and results in dry skin. The mere act of getting in water can dry out the skin, simply because when you get out of the water, the water on the surface of the skin starts to evaporate and draw water out of the skin, and if left to do so, results in pretty dry skin. Furthermore, the use of soap on the body, like particularly on the legs and the arms, soap itself is a detergent, and detergents dissolve the skin barrier and the skin barrier components. Okay, there's really no detergent that doesn't do that to at least some extent. Even the quote gentle ones disrupt the skin barrier at some level. Okay, so come in with not only the effects of water, but also the effects of soap on just disrupting the skin barrier. That alone is going to lead to dry skin, particularly if you don't combat it with a moisturizer, which I'll talk about later. But that phenomenon, that is called transepidermal water loss. Okay, it's water on the skin in and of itself is drying because it evaporates, draws water out of the skin by virtue of transepidermal water loss. Soap and cleansers accelerate that by dissolving more of the skin barrier and further allowing water out. That's why for me personally, I don't use soap on my body at all. People are always shocked by that. I only use it in areas on the body that are prone to breakouts related to working out. And I don't use soap on my legs, on my arms, on my back, ever. There's really not a need to decontaminate the skin unless you've been told to by your healthcare provider for a particular health condition, because really it just compromises the skin barrier. The mere act of getting in the water and the gentle abrasion from your hands and the water going over the surface of the skin will remove the majority of dirt and oil that may have built up throughout the day. There's no need to come in with a detergent to remove that. To be honest with you, they make a variety of gentle non-soap cleansers. I will list some down below. So if you feel strongly about using a soap, I would recommend those because they tend to be far less drying, far more gentle, and they're of a pH that is important for the skin barrier. So I'll list those down below, and I'll list a variety of them. So hopefully I can include some that are available in your country. I know I tend to just be most familiar with those brands that are available here in the US. The other bathing practice that can be problematic is using alcohol-based things to the skin. I find that this tends to be more problematic on the face, where people are using toners that have a high percentage of alcohol in them. So, if it kind of smells like alcohol or rubbing alcohol and feels like it, it's probably just annihilating the top layer of your skin and really drying it out. So I would caution you to avoid doing that. But the other thing that is really, really problematic is frictional irritation, okay? Can further impair the skin barrier and lead to really bad bouts of dry skin on the body. By frictional irritation, I mean aggressive scrubbing with a loofah, with some sort of a salt scrub or scrub. So I would advise you to consider stopping that if you're doing that. It really has no role in skincare other than to make the loofah companies money. Some of you have an interest in kind of some of the biologic principles behind some of skin and skin barrier maintenance. I get many questions about that. So just a few biologic points and physiologic points about the skin barrier and and how it relates to dry skin. Some conditions with dry skin, there's an overall reduction in the lipid content of the stratum corneum, or the very top layer of our bedding of our epidermis. Also, sometimes the ratios of different components can be skewed abnormally, because they're not in the right proportions, the barrier doesn't function optimally. And these components include things like ceramides, which I always mention, as well as cholesterol and some of the free fatty acids. Those components can be altered. And in certain diseases, there can be a reduction in the rate of cell turnover of the keratinocytes, or proliferation. The keratinocytes are the cells that make up our stratum corneum. And so that biologic, the consequence of that reduction in proliferation is a compromised skin barrier. As this balance becomes disrupted, what ends up resulting is that the keratinocytes are the skin cells in the top layer of the skin are abnormally retained, and this reduces the overall water holding capacity of the stratum corneum. This results in dry skin that has a dull appearance, the appearance of scales as a result of some of those retained keratinocytes on the top layer of the skin. But it can also put you at risk for some other things. This scenario of dry and inflamed skin is kind of a prime setup for you to develop allergies to things that come in contact with that dry and inflamed skin, because as the skin barrier is impaired, more allergens kind of get in, and our immune system has way too much going on, and it just says, get out, I don't like you. So it's really a setup for developing skin allergies when you've got uncontrolled dry skin on the body. But my tips for dealing with dry skin is to reduce the frequency of bathing. If you're bathing twice a day, that's probably too much. No more than once a day. Limit the shower to less than 10 minutes would be conservative. And also the water temperature should be lukewarm. Hot water tends to exacerbate dry skin quite a bit. Also, another tip is to keep a humidifier in the bedroom. And then as far as your soaps that you are bathing with, select a more water mixing friendly oil in it. I will list some down below for you guys, as I mentioned, that are helpful. And consider avoiding your bar soaps and harsher soaps like ivory soap, for example. Also, avoid the use of a loofah or a scrub, as this can exacerbate dry skin. And then as far as applying a moisturizer, select a moisturizer that is thick and greasy, that comes in a tub, for example. I happen to be a fan of CeraVe moisturizing cream, but there are many others, which I will list down below in the description box, that are likewise fantastic. The best way to put on a moisturizing cream is directly onto wet skin when you get out of the shower. Do not towel dry off the water off of the skin, because if you think back to the discussion on transepidermal water loss, really what you're doing is just accelerating that by wiping it off with a towel, okay? Instead of wiping it off with a towel, cover it up with a layer of moisturizer. That will seal in the water into the skin, and just get out and, you know, allow the skin to kind of air dry, and you'll find that it does so fairly expeditiously. I know it's a little bit difficult to embrace that concept, particularly when it's freezing cold, but it is very helpful. I emphasize selecting a moisturizing cream, something that is thick, because that tends to seal the water in best. For really, really bad cases, rather than a cream, you would select an ointment, like Vaseline or CeraVe healing ointment, okay? To kind of red, raw areas on the body. Those are very, very occlusive and make excellent barriers, okay? But they can be a little bit thick and sticky to tolerate all of the time, okay? So if you've got a really bad bout, select an ointment-based moisturizer. I will list some down below. If you're just daily getting out of the shower maintenance, moisturizing cream, which I will list down below. And then thirdly is the use of lotions, okay? Lotions like Lubriderm, Jergens that are really popular. These come in a pump for the most part, and lotions tend to be a lot more watery, so they're not as fantastic at sealing the skin barrier tightly closed after a shower, so I don't recommend those after showering. However, they are kind of easier to put on throughout the day, so they're fine in that situation, okay? So for example, you're going about your day, you're at work, you may go into a meeting, they've got the heater cranked up, you may be in a car with the heater on your commute home, and your skin is getting like super dry. You know, applying a moisturizing lotion throughout the day can help protect you against the dryness of just our day-to-day lives, not outside of the setting of bathing, okay? So lotions are good in that situation. And I will list some down below for you guys that are really good. And then I get many questions about like using rosehip oil and all of these like oils as moisturizers, and they're really not fantastic moisturizers on their own because oils are very slippery, okay? And they pretty much just slide off the skin barrier and they don't seal the water in, okay? Yes, oil and water do not mix, but they're not occlusive, okay? So they can kind of help soften the skin a little bit, soften the edges of the cells on the top layer of the skin, but they're really not good water barrier sealants like what you would get in a cream or an ointment, okay? Oils in moisturizing creams, however, can be good. Certain ones like jojoba oil is fine, and that sort of thing. You know, in moisturizing creams as an ingredient, they can be helpful, but on their own, they're not good enough. But things to avoid in moisturizers are fragrance and essential oils, period. Those are associated with a high likelihood of developing an allergic contact dermatitis, particularly if you're putting them onto dry skin that is inflamed, cracked, fissured, because the skin is open, it sees the fragrance, it's trying to, the skin and the immune system are trying to heal the dry, cracked skin, and you're putting fragrance on top, which the body just doesn't like, okay? And as the skin barrier is impaired and open, your immune system is in there trying to do its job, and it says, get out, get out. You can develop an allergy. It's a setup for developing an allergy to that. Many people ask me about ingredients like mineral oil, dimethicone, and parabens. Are they safe? Are they pore clogging? Are they dangerous? Should we be avoiding them? No, they're very, very safe. Mineral oil and dimethicone are fantastic moisturizers, very, very safe, non-pore clogging. You know, they're very, very excellent moisturizing ingredients, not associated with harm to human health. With regards to parabens, parabens are preservatives that are important in skincare products to prevent them, you know, to prolong their longevity and to preserve the ingredients. People can develop an allergy to parabens. However, it is far, far, far less common than fragrance allergy, okay? So, you know, it's not something to like focus on as much as avoiding the fragrance. And, you know, ingredients to look for in moisturizers include something called ceramides, which our body makes and can become deficient, as I said, with age or certain skin diseases and predisposed to dryness. And what we know is that applying ceramides onto the top layer of the skin can actually help restore the skin barrier, as well as help encourage our body to make more of our own ceramides, okay? So looking for moisturizers that contain ceramides is helpful. But if you can't find a ceramide containing moisturizer, that's okay. I will, you know, list some down below that don't have ceramides in them. And really, guys, while the ceramide containing moisturizers have been shown to help the body make some more ceramides on their own, bigger studies have shown that people with eczema, for example, using any moisturizer that is fragrance-free in particular consistently helps the skin barrier get back to where it's supposed to be. And once it starts getting back to where it's supposed to be, it starts making more of its own ceramides. So the bottom line is finding a moisturizer that's accessible, affordable, and one that you like and will use is really the most important thing, okay? I encourage you to choose ones that are fragrance-free, essential oil-free, and, you know, hopefully some of the tips on components of the moisturizer as far as the vehicle, cream, lotion, ointment will be helpful to you guys. But the bottom line is, if you find one that you like and you use consistently, the data shows that that's going to help your skin barrier the most. So yeah, like I said, in the description box, I will list some occlusive ointments for you guys that are fragrance free and are great if you've got kind of open, raw, dry, inflamed skin and you really need an aggressive sealant. I will list moisturizing creams that go on, that are great going on to a wet skin of the body out of the shower to seal in the water. And then I will list some nice light lotions for the body that are good for maintenance throughout the day and reapplying, easier to reapply throughout the day. And then I will also list some moisturizers for the face, even though in this video I didn't really talk about dry skin on the face. So yeah, I will list a few of those down below, and then next week I will post a separate video on some of my favorite moisturizers and what it is that I like about them as both a consumer and, you know, kind of from a skin health perspective in that video. So if you're interested in that, stay tuned for that, but check the description box if you're looking for some moisturizers to help dry skin this winter. Get yourself a humidifier and have a great upcoming holiday season. Whether you be celebrating Thanksgiving, Hanukkah, Christmas, getting in the spirit. So lots of fun things in store. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next Q&A. Bye.